Almost 500,000 healthcare workers who received a Johnson & Johnson COVID-19 vaccine under the Sisonke trial study rollout at the beginning of the year are expected to receive a booster shot. Reports suggest that this could happen within a week. Some wealthy governments around the world have already started giving a second shot in the case of Johnson & Johnson and a third dose of the Pfizer and Moderna vaccines. The decision to administer shots to essential workers, the elderly and people who are immunocompromised was taken after studies show that the vaccine's efficacy against COVID-19 does drop in some people after a few months. Chairperson of the South African Medical Association, Dr. Angelique Coetzee, is joining us now to talk about health workers here at home. Doctor, a very good evening to you. Good to see you on this Friday evening and welcome to News at Prime. So you want the booster shot rollout for healthcare workers to happen as soon as possible. What are you hearing about when it'll actually happen?
Good evening. Good evening to everyone out there. Good news is it will start on the 8th of November, and it will be called Sisonke 2, and it is only for the healthcare workers who received in February this year, also under the Sisonke program, vaccines. That would be the only people eligible for getting a booster shot. Mm-hmm. From Johnson & Johnson.
And Doctor, given the research that's out there on booster shots and their efficacy, is it absolutely necessary for people who took the J&J shot to get this booster?
So for the doctors and the nursing staff, the healthcare workers, that, as I've already said, received it in February, we know that some of the data is showing that the efficacy is weaning off between 6 and 8 months. It still gives you good protection. We saw that in the third wave that 94% of the healthcare workers who experienced breakthrough infections following the immunization with Johnson & Johnson only had mild to moderate symptoms, and the efficacy of the vaccine effectiveness was around about 65% in reducing hospitalization. It was a bit lower than seen following the two Pfizer dosages, but still very, very good. Unfortunately, we do expect a fourth wave. When? It's a big question. There's lots of speculation out there. It would either be end of December, beginning of next year, or if it's not beginning of next year, it will most probably then be in the winter time. So we need to get our healthcare workers a second shot, as we have now seen with the studies out there. And it took nearly 6 weeks for National Department of Health and Prof. Brenda Gray and her team to negotiate in the background for those healthcare workers under the Sisonke to get this booster. Whether you want to call it a booster, whether you want to call it a second dosage, we're not sure. Mm-hmm. Remember, this is also data that is evolving, and regionally it was said one dosage. And maybe this study, the second Sisonke trial will then give us much more information regarding when a second booster shot would be necessary.
So just on that point then, from the people who will then in South Africa and the healthcare sector take this second vaccination from J&J, that data will then be taken and analyzed, am I right, for research purposes?
Yeah, definitely it would be. And that, so Johnson & Johnson donated nearly 450,000 vaccines. So these vaccines that's going to be administered to the healthcare workers under the Sisonke will not pay for that. Remember, there are healthcare workers who got vaccinated later as a part of the public and not under the Sisonke. Mm-hmm. We're not talking about them. We're only talking about Sisonke 1 vaccine recipients.
Interesting then, Doctor, that these healthcare workers are going to get another Johnson & Johnson shot? Because currently, globally, there are suggestions in the scientific community that the best thing, in fact, to do for people who've been vaccinated with J&J is to give them either Pfizer or Moderna because of, I don't know if I'm phrasing this correctly, the different scientific structure, shall we call it, of those vaccines and how they perform better as a booster for J&J.
You're absolutely correct. The problem is, however, Pfizer needs to apply to SAPRA and to say, please, can we run a trial simultaneously with those doctors who want to get a Pfizer vaccine and not the Johnson & Johnson. So National Department of Health looked at this, and it became very difficult and technically, and they saw that they were running out of time. So again, this only to get the Johnson & Johnson approved, up till now, it took them 6 weeks. So it's going to take much longer with the Pfizer. So it's not that government is unwilling, but yes, SAMA will ask and plead Pfizer, the Pfizer company, to please come to the party. Please apply to SAPRA. Get your homework done. Let us please run for those doctors who want Pfizer in a parallel study and with the Johnson & Johnson and the Sisonke, so that we can look at the data going forward. Remember, this is for healthcare workers. This is not for the general public. And that data is important. I also would like to say Pfizer company needs to take cognizance of the fact that we as doctors prescribe their products on a daily basis. And this once we ask, please come and join and help us to run a study parallel with the Sisonke.
And just on that, Doctor, we are hearing predictions now that we could possibly go into a fourth wave of COVID-19 before the year is over. Then that would stress the importance of making sure that healthcare workers have the highest level of protection possible in the event that that happens.
Exactly. That's why, for now, you know, and I need to thank Prof. Gray and again her team for the hard work. You know, 6 weeks, a lot happens behind the scenes. There's really a lot of work done. I think this would be the first trial you know, with healthcare workers, if we can call it a trial. And this is Sisonke, and this is called Sisonke 2. So they made it again happen. They also came to our rescue the beginning of the year. And from SAMA side, we really thank them. But now we're also asking Pfizer, please come to the party. Please assist us for those doctors and nurses and other healthcare workers who want to run a parallel trial with Pfizer to please apply. Please, let's get that homework done and get this going.
Dr. Angelique Coetzee from the SA Medical Association. Always good to speak to you, ma'am. Thank you for your time.